Thank you, Presiding Officer. This week's health figures revealed that more people are waiting longer than ever for emergency treatment. Across Scotland, over the last week, nearly 10,000 people waited more than the target 4 hours at accident and emergency departments. That's the worst waiting times on record, and it's only September. Our doctors, our nurses and staff are doing outstanding work, but we know the pressures on our NHS only get worse over the winter. So, First Minister, what action is your government taking now to reduce the time that people are waiting for emergency treatment here in Scotland?
First Minister.
Thank you, Presiding Officer. As the Health Secretary said earlier this week, the most recent performance in accident and emergency is not good enough, and I am very clear about the need for improvement. The most recent performance, of course, does reflect the very significant pressure across health and social care, arising obviously from the 2-year pandemic, but also from some pre-existing factors, the changing demographics of our country, for example. So there is a very sharp focus on doing what requires to be done to improve that performance. So that takes me to the specific question. In addition to what has been a 263% increase in accident and emergency consultants since this government took office, we are firstly investing more to support further recruitment, overseas recruitment included, and we're taking action through the £50 million urgent and unscheduled Care Collaborative. That work includes a range of different strands, offering alternatives to hospital where that's appropriate, such as hospital at home, directing people where appropriate to better urgent care settings, and scheduling some urgent appointments to avoid long waits in accident and emergency. The Chief Operating Officer of the NHS also wrote to health boards this week with 5 additional specific actions that we are expecting health boards to take. So we do expect to see improvement, and we want to see that improvement starting to be visible immediately. Final point I would make, Presiding Officer, is for the sake of those working so hard in our National Health Service, to put this into context. Our NHS is facing these significant pressures, but the NHS in every part of the UK is doing so as well. And while performance needs to improve here in Scotland, our accident and emergency departments are performing better than those in England, Wales and Northern Ireland. So for context, because it is important to put it in context, if we look at the last complete month where we have figures, performance against the 4-hour target in Scotland was 66.5%, not good enough, and it needs to improve. But that compares to 57% in England, 55.2% in Wales, and 45.7% in Northern Ireland. So these pressures exist everywhere. This government is focused on making sure we support those in our health service to tackle them.
Douglas Ross.
Context may be important for the First Minister and her members behind her, but for people waiting hours and days for A&E treatment, they are hollow words. We're now more than a year into the Health Secretary's recovery plan, but the situation is getting worse, not better. The First Minister spoke about A&E consultants, but here's what doctors on the front line are saying. The Deputy Chair of BMA Scotland said this week, "As an A&E doctor, I often tell people that A&E is a safe space. You can come here if you're in pain, if you're sore, if you don't know where to go." But Dr Peel continued, "Our A&E departments are no longer safe. And what's really concerning is our government just aren't acting, and they're turning a blind eye to this." And new information that we've uncovered shows just how horrendous waiting times are in Scottish hospitals just now. An FOI response has revealed that one patient at a hospital in Ayrshire had to wait 84 hours for treatment. That's 3.5 days, the equivalent of turning up for emergency treatment right now and not being seen until next week in the early hours of Monday morning. First Minister, is that really what anyone in Scotland should go through in 2022?
First Minister.
No, and that is clearly an unacceptable situation, but also an exceptional situation, and I'm certainly more than willing to look into the particular circumstances around that. I've been very clear, firstly, that the current performance is not acceptable. I would not and do not shy away from saying that. Secondly, I've been very clear about the action the government is taking to support those on the front line to ensure that there is much speedier access to accident and emergency and to healthcare services more generally, and also to make the important contextual points, because this is part of giving confidence to people that we are taking action to address this. So in terms of performance against the 4-hour waiting time target, not good enough, but better than in counterpart parts of the United Kingdom. And again, in terms of long waits, 12-hour waits are 50 times more in England than they are in Scotland, 4 times higher in Wales than in Scotland. That does not mean that performance in Scotland is good enough, but Douglas Ross and others often come to this chamber and somehow pretend or suggest that these issues are unique to Scotland. They are not unique to Scotland. They are pressures that all health services are facing, and I am setting out rightly the action we are taking to support the health service in tackling these. So in terms of recruitment, in terms of investment, in terms of changing the pathways of care to make sure that people not only get speedier access, but access the right part of the health service at the right time, we are taking action across all of these strands and will continue to do so.
Douglas Ross.
Unbelievably, the First Minister just said there that 84 hours is not good enough, but it's better than other parts of the United Kingdom. How does the person who was waiting for 84 hours feel when they hear that? Their friends and family. And while that was the most extreme example that we found, it's not the only time that someone has waited 4 days at A&E. Our FOI responses reveal that another patient waited 79 hours earlier this year, another 66 hours, and another 53 hours. There are thousands waiting each week for longer than the government's target time. A constituent wrote to us about their grandmother, and this is what they said. My nana took a turn for the worse last week and could not stop vomiting. Due to her type 2 diabetes and blood pressure, this is a very serious condition indeed. She was admitted to hospital after a lengthy wait and then sent home. This happened several times over a number of days. Finally, she had to be rushed to A&E, and her grandson told us this. What I was faced with was utter chaos. I felt so sorry for the doctors and the nurses and helpers. They were literally at breaking point. There were beds and people everywhere. I wish I had taken a picture, but the image is etched in my memory forever. The beds were wall to wall, and my nana had to stay in her mobility chair as there was nowhere for her to go. First Minister, this can't go on any longer, and it certainly can't go on through the winter. So when will people in Scotland get access to emergency treatment that they deserve when they need it?
First Minister.
Well, as I said earlier on, we expect to see and we are supporting what it will take to deliver immediate improvements in accident and emergency waiting times. These are really serious issues, as the case that Douglas Ross has narrated today illustrates, and I would not say otherwise, but it doesn't do anybody any service at all to deliberately twist and indeed misrepresent what I said in my previous answer. I did not say, and it's really important to be clear here, that 84 hours was not good enough but better than anywhere else in the UK. I said our 4-hour performance was not good enough but better than other parts of the UK. And I said that our longer wait performance was too. What I said about 84 hours was that that is clearly unacceptable. But cases like that are also exceptional, and it's important that where cases like that do occur, they are properly looked into. In terms of our performance against the 12-hour target, in the most recent week, very challenging, the lowest 4-hour performance on record, and it's important to be clear about that, but more than 9 out of 10, 95.4% of patients were seen within that 12-hour target. So clearly exceptional cases shouldn't happen, and when they do, lessons should be learned. But it is important not to misrepresent the situation or to misrepresent what I said. In terms of the action we are taking, because that is what obviously matters, I have referred to support for recruitment, and it is important to point out to the 263% increase in A&E consultants. We're also investing £11 million to support further domestic and international recruitment, and of course international recruitment has been made significantly harder because of Brexit, and I'll just put that on record. It also includes 1,000 healthcare support workers that were brought in over last winter, and the £50 million investment that I've already referenced, looking at alternatives to accident and emergency where that is more appropriate for patients. So we'll continue to focus on improving this performance, and to end this answer where I started, we do expect to see performance improve immediately.
Douglas Ross.
We've been told this before. There's going to be immediate improvements, and then people are waiting 84, 79, 66, 59 hours. And the First Minister says these are exceptional cases. So let me give her another one, because there are just so many. We spoke to another patient who attended Monklands Hospital. She was stuck at A&E again and again and again, waiting for emergency treatment. She went to A&E with severe abdominal pains. She was left waiting, vomiting, in extreme pain for 9 hours. She was told to come back the next day at 9 a.m. This time, she waited a further 6 hours. 2 days later, her condition had worsened to the point that her GP told her to go back to A&E for urgent treatment. On this occasion, she again waited 9 hours. That's a total of 24 hours waiting for emergency treatment in just 4 days, all in extreme pain. So she wants to ask one simple question to the First Minister. How can you allow this to continue?
First Minister.
We're not allowing this to continue. We are recognising the significant pressures on our National Health Service, and let me say an experience that is completely unacceptable, but there are significant pressures on our National Health Service and significant action being taken to address those pressures, and we will continue to take those steps around recruitment, investment and redesigning pathways of care. I don't know whether it is the case in the particular instance that Douglas Ross has just narrated, but there will be many people who end up in accident and emergency departments who would be better seen and treated in other parts of our National Health Service. That's why I said I didn't know if that was the case in that particular instance, but there are many people who would be better treated in other ways. That's why we are investing in hospital at home, in different urgent care settings, and in scheduling urgent appointments in A&E so that people don't have to have long waits. This work does take time. This work requires that investment in recruitment that I have spoken about, but that is why the Health Secretary and the Government is focused on making sure we do it and support those at the front line of our health service as they support patients who need treatment on the National Health Service.